Okay, good afternoon, everybody. Thank you all for coming out today to get the latest here on what's happening in Louisville as it relates to the coronavirus, COVID-19. You'll be hearing from Dr. Moyer, John Dwyer, and Marty Polio. Dr. Polio here today. I want to thank Keisha Dorsey for being up here representing the Metro Council, and Nicole Yates for representing our federal government here through the Congressman's office. And thanks everybody for tuning in here today. So as of today, Louisville still has only one confirmed case of COVID-19, one of 8 now COVID-19 cases in Kentucky, 5 in Harrison County, 2 in Fayette, and 1 here in Louisville. I have a good update on the case here in Jefferson County. The patient has improved and has been discharged from the hospital to finish his isolation at home. So that shows how when we can all work together on these type of things and proper care is given here at Norton in this case, good developments can take place. Let's remember, for Louisville City government, our number one job is to protect the public, and we are committed and will continue to be committed to communicating what we can as soon as we can, including our work to be prepared for more cases in the event of a broader spread. As we have said, and if people, as they pay attention to the news, this situation is rapidly evolving, especially with the amount of news that's coming with people. So we are learning from what's happened all around the world, what's happening here in the country as we implement our practices here as well. I have heard from quite a few people that they're somewhat taken aback by all the measures that are being announced by the governor, by myself, and by other officials. I just want to emphasize the reason why we're doing that is as we look at other cities and we look at other countries, we have seen how this virus can rapidly spread up to 10x per week if the proper preventive measures are not taken immediately. So what we are trying to do with each and every decision we make is to prevent that from happening here in our city, in our Commonwealth. So we ask for everybody's understanding if they're inconvenienced by this or their routine is somehow changed, just to say, okay, I've got a new routine, and my new routine is making sure that we're keeping myself safe, those that we love around us safe, those that we don't even know safe as well, and that is the nature of a pandemic. So we all have new roles to play as citizen as we work through this, and we will work through this and get to the other side of it. Now, for a couple updates since yesterday, as it relates to the conference at the Omni Hotel that was held in February, we're aware of a confirmed and 2 additional presumptive cases of individuals who attended a conference in Louisville and later developed COVID-19 after they returned home. We're communicating with the other local health departments on the 2 new cases, but on one, we don't know if they contracted COVID-19 in Louisville, and 2, given the timing of the onset of their symptoms, it's unlikely that they were contagious while they were here in Louisville. As we know more about that, we'll communicate it. As it relates to the jail, during a press conference this morning, the governor announced all state prisons would be closed to visitors and recommended that local jails follow suit. Under our current policy at the jail, our existing policy, visitors do not come to Louisville Metro Department of Corrections. Visitation is non-contact through a video screen. So that will continue. However, we are looking to see if we can stagger the visitors so we have fewer visitors gathered in the video room at one time. And we're canceling non-court ordered services in our jail, but are looking how to provide these services alternatively when visitors would come into the jail to provide those services. On the houses of worship, also today the governor issued guidance on visiting houses of worship. We realized that quite a few people are upset about this, but we just asked everybody to kind of keep the bigger picture in mind here and take guidance into consideration on how you can do your part to make sure that we don't have spread of the virus, and then make that all in consideration of what's important to you. We just want to remember, when large groups of people are together, especially people that are in vulnerable populations, those who are 60 or those with chronic conditions, the odds of the virus being transmitted go way up. And none of us know knows who has it either. So please limit any possibility and do your part in this. For Metro employees, the nature of our city government work is very diverse. It can be 24/7 type of exercise, let's say like the police department, the fire department, our EMS services, to back office billing. So we have to have some discretion by departments on how we implement a work coverage system here. So my human resources team will develop here by Friday an emergency paid sick leave policy for employees who are in medically directed isolation. We're also working on telework and other workplace options. In order to effectuate these changes, we are working on an executive order that outlines steps we can take to mitigate any negative impact on Louisville Metro government employees and therefore our ability to continue directing services to our citizens, because of budgetary challenges, we had already limited travel for Metro employees to only that travel that was essential, and that policy will continue as long as the trips are not contraindicated by CDC guidelines. My office had a call with the White House earlier today, along with many other mayors and their teams around the country. The White House reviewed agency by agency their activities to contain and mitigate COVID-19 and offered a review of recently congressionally approved resources that will become available to state and local public health departments in the days and weeks ahead. We will be working with our state partners to quickly see what resources we need and are available to us. As it relates to events, we've formed an internal work group driven by public health considerations, which is reviewing large events that are scheduled to happen in the city. Based on the recommendations from the state earlier today, we are updating the guidance on those events. So I'd like to bring up Dr. Moyer to brief us on that updated guidance. Dr. Moyer.
So good afternoon. As you probably heard today, COVID-19 is now being called a pandemic by the WHO. From the last pandemic, Spanish flu in 1918 to 1919, we know that early social distancing decreased transmission and decreased deaths. Because COVID-19 is so new, the data we have is based on this recommendation in response to what we saw in China, where early social distancing and cancellation of community events was one of the major interventions they made. And we know that this disease is having very different outcomes for the young and older populations. With the young and healthy, it's almost always a very mild disease. But for those over 60 with chronic conditions, it can be deadly. We're seeing that the mortality rate out of the nursing home in Seattle is over 50%. So today we're recommending new guidelines for events, and we're making this based on what we know from other jurisdictions, the potential risk to our community members, and with the protection of public health as our first and primary priority. So out of abundance of caution, we're recommending that all congregate events consider cancellation. We have the following guidance to assess risk on an individual basis for each event. Whenever possible, consider alternate ways for participants to enjoy your event by either television, radio, or online. But should you decide to continue with your event, the following preventative measures are recommended for individuals to reduce the transmission of COVID-19. First, stay home when you are sick. Also, avoid contact with people who are sick with fever, coughing, sneezing, difficulty breathing. And so to avoid contact, stay at least 6 feet away from others. Avoid touching your nose, eyes, and mouth. And as always, cover your cough and sneeze with a tissue and then throw the tissue in the trash. To avoid coughing into your hands, you can use your elbow. Also, clean and disinfect frequently touched objects and surfaces using a regular household cleaner, spray, or a wipe. Wash your hands with soap and water for at least 20 seconds, especially after going to the restroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not available, you can use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty, though. The risk of transmission of COVID-19 is possible with conference attendance, so goals of public health recommendations include reducing the risk of transmission in the community and then reduce infections of high-risk individuals with a higher likelihood of poor outcomes. So just more factors that we will be posting online to just help you decide how to hold your event, whether it's indoors or outdoors, and other things that you can do to decrease transmission. The biggest thing, though, is just how the event will impact high-risk individuals in the community. And so please take into consideration the age and health status of the attendees. And so if your event is targeting either of those audiences, then it should be canceled. We do not yet know the outcome of COVID-19 on fetal outcomes, so pregnant women should also take this into consideration and maybe be considered as part of the chronic medical conditions. And then just make sure you communicate well and let everyone know how your event will be held in the future. So thank you, and I will turn it back over to the mayor.
Thank you, Dr. Moyer. I'd like to thank you and your team. I know you guys are working 24/7 on this, so thank you. Okay, next I'd like to bring up a great citizen, John Dwyer. He runs the St. Patrick's Day Parade, and he is the president of the Irish Society of Kentuckiana. John.
Good afternoon. My name is John O'Dwyer. I am the president of the Irish Society of Kentuckiana, but as it relates today, I am the president of the Ancient Order Hibernians, who host the St. Patrick's Parade every year through our charitable arm known as the Hibernian Cultural and Charitable Association. It's our 501c3. That we use that parade to raise money for charity for everybody around the region. As we have gone through the process of planning the parade this year, we've paid very close attention to state, city, and healthcare professionals and officials to guide us through how we were going to have this parade, the 47th parade here in Louisville. With the help of all the entities involved, we've made a decision that we will postpone the St. Patrick's Parade this year. And postpone is a specific word because we will come back and do something later in the year. The bottom line of it is the parade is fun for everybody in town, and it's there to help those in need in town. And there's an Irish saying, you don't iron a four-leaf clover, you might press your luck. Well, as we're trying to take care of the community through this event, we didn't want to press our luck and hurt anybody or put anybody in peril. So we will look forward and try to set this up again in the future. It's important not just for the well-being and the fun of the community, but there are a lot of businesses that run their business plan around that day. The revenues generated, there are employees that plan on their payday around that day. And there's the charity that we need to raise money and go out there and help folks. So we are not going to give up the cause. We're just going to do it in a very safe manner, and we'll continue to do it with all of the experts and the officials from the city and state so that when we do this again, it's going to be a fun day. Nobody has to get worried about getting sick. So I appreciate everybody. I appreciate your understanding. People might be upset at the decision we made, but I think it's the right one, and we'll carry that forward. So thank you.
Okay, thank you, John. Thanks for being such a great community partner. We appreciate you and all the good stuff you guys have done over the years. And that's speaking from Greg O'Hallahan Fischer. I've got a little Irish in me, too. Okay, schools. Also, the governor gave some updated guidance to schools today. So we're joined by Jefferson County Public Schools Superintendent Dr. Marty Polio to speak to their preparedness efforts. Dr. Polio.
Thank you, Mayor. I'll start by once again how I've always started, that it's important to note that we're taking every precaution to ensure the safety of our students during this difficult times. And as was stated by the mayor, we did have a conference call. Superintendents around the state had a conference call with the governor. At this time, there is no recommendation to close schools from the governor. At this time, learning will continue in our buildings and JCPS will remain open. But there was a clear message from the governor that schools should begin to prepare for that possibility in the very near future. As well, we're following the lead of the governor when he talked about all out-of-state travel. So at this time, all district out-of-state travel for employees is suspended, along with all out-of-state field trips until further notice. All district in-state field trips can still go on as scheduled at this time, and that's for now. We know this is a fluid situation and can change on a daily basis, including whether we will hold school in the near future, as was told to us by the governor. So he asked schools to be ready for the possibility of closures, and JCPS is prepared for that. So we have spent the majority of the past 7 to 10 days developing supplemental materials for our students at every single grade level, and that will provide continuous education opportunities for students and for families. So this will be available online. We are also developing hard copies, and we will be distributing those to students as soon as we are informed of any recommendation for closure. We've also been in contact with our Nutrition Services Department. They are preparing a plan for meals if and when the recommendation is made to close schools, because we know that would have a significant impact on our community. As we know, kids go home every weekend, and we have great organizations like Blessings in a Backpack that provide food for our students who might not have meals until the following Monday. So we know having a plan for nutrition services in place if and when the recommendation is made for us to close school. And when that happens, we will be providing that information to the community so that they can access meals. Once again, we will continue to provide information to our families. We're working on this diligently to make sure that we provide continuous learning opportunities and the social services, the wraparound services that we provide our children and families, because this is an important time. We know that. And we also don't want our families and students to be left without those important services that they need. So we'll provide continuing and ongoing communication to our families and to our schools and continue to work hard for the safety of our students. Thank you.
Thank you, Dr. Polio. Obviously, we'll continue to remain in contact with JCPS and are working with our agencies to prepare for the ripple effect we may see on libraries, community centers, and other city services if schools are canceled. We've been in contact with the University of Louisville, and we'll continue to work with them on the news that they issued today regarding their new schedule. So in closing, look, it's only normal right now for people to be saying, what is going on? We just want you to know that your government agencies, both here locally and at the state level, are doing everything we can to access the latest information, to learn from other cities, states, and countries, to put everybody here in Louisville in the safest situation they possibly can be in. And that will take all of us to do that, as we've been emphasizing over these last several days. It's a matter of us taking care of ourselves as individuals, and then recognizing our collective responsibility when we get together with other folks, so how we can all safeguard each other. So I encourage folks to always be thinking about that in the time from now until when we get through all of this. And so what's most important is for everybody just to remember those basic things that we're repeating over and over again, so that you're taking appropriate steps to keep all of us safe. Number one is what? Wash your hands for 20 seconds, okay? So sing the happy birthday song twice. If you don't know anybody that's having a happy birthday, wish Sarah Moyer a happy birthday. She just had her birthday the other day. Happy birthday, Sarah Moyer. We appreciate you. Then avoid touching your eyes, your nose, and your mouth so you don't transmit that way. Cough or sneeze into an elbow or a tissue, then throw the tissue away. Avoid contact with sick people, okay? And stay home if you're sick. So that's a lot of the guidance around the senior homes and the long-term facilities that Sarah mentioned, Dr. Moore mentioned here earlier, with, fatality rates up to 50%, okay? So I know people are upset not being able to see their loved ones in senior homes right now, but just follow the data on where we've had the highest mortality rates from this virus. Rather than shaking hands for the time being, do the elbow bump, get creative if you want, do 1, 2, twirl around, do a 360, tap your shoes, just don't shake hands, okay? And then if you have any questions, please call the Kentucky Coronavirus Hotline that you see on the screens, 800-722-5725, or the definitive source of knowledge in the state right now is kycovid19.ky.gov. Okay, and last, tomorrow we will hold another preparedness exercise with all of our community partners, both internal and external, to ensure we're covering all of our bases as we work through this situation together. This will be a virtual exercise. In other words, we're not all gathering together in one spot like we're advising people not to do, but the benefit of that virtual exercise will not only be safety for all involved, but it will also allow us to test that system, which if we had to do a broad-scale community response, it would be done virtually anyway. So we're looking forward to what we learn tomorrow, and we'll report back on that. With that, we're happy to take any questions.
Coachella was recently canceled, and the second weekend is the same weekend as Thunder, and Coachella has about a third of the amount of people as Thunder would in one place. Any update as to what's happening with Thunder? Would it still happen with just no congregating crowds? Or Derby would Derby want to get out? People in the stands?
Yeah, you're thinking on right along the same lines that no decisions have been made around that, but those are the kind of factors that we will be taking into consideration. Here's some news that's just come across that the NCAA men's and women's basketball tournaments will not include fans due to the coronavirus concerns. So, hopefully what we're doing is we're mitigating all this so that it's gone sooner than later, and then we can reassess some of these other dates. But we're very cognizant that as each day goes by, people are asking these questions more and more. And we also want to say, not all events are the same. I'll repeat what I've said the prior days. Crowded indoor events with old people, not good, right? Outdoor events with young people, not that many of them, it's fine.
Can you talk about how you're working with other agencies in the event that schools would close? What parents who do have to work or don't have the option to work from home, what kind of plans or work are you all working on?
Yeah, we mentioned that briefly in here. So like from our government standpoint, it's what's going to be the impact on libraries and our community centers and what's that staffing look like. So we're running through all those contingencies right now. We're very cognizant of the fact that if school's out, what's that mean to child care and how is that all going to work out? So as we're talking about this right now, and what Dr. Polio mentioned with the 72 hours is we want people to be thinking through what their individual situations could be right now versus waiting until something happens. So it's all very much a work in progress that, we all got to do our own part during this.
You touched briefly on the White House bringing funding resources from the federal level. Are you worried at all on a local level about the budget? We've had to cut multiple things over the last few months. Is this something that would affect further things from being cut because we need that funding for COVID-19?
Well, one of the things that we've done throughout our budget cycle is to keep a healthy rainy day fund so that in the event there's an extreme challenge to our budget, we will be able to overcome that. We have I think it's $75 million or so in the rainy day fund, so that will be enough to help us through any kind of emergency or disaster that we need to get through.
As far as like the conference, like a couple of cases from another conference, I know you said that it's not likely that the coaches will be here, but what are the chances there could be a conference in Louisville following that gathering?
That's related to that? Well, I would just say we really don't know. I mean,
Yeah.
Dr. Moore, do you want to comment on that?
Right now, testing is happening in the sicker patients in the hospitals, and based on that, we would already see disease happening from that, so monitoring, and we'll update you if we have any more information.
Okay, thanks everybody for coming out. We will continue to communicate on what we know. Everybody take care of themselves. Wash your hands.
Trying to find the truth, got the